Cardiac disease is the #1 killer of both men and women. In efforts to provide faster and better cardiac care to Hawaii residents, Straub's Heart Center was the first in the state to acquire a revolutionary interventional cardiac biplane cath lab. Straub Heart Center facilities includes 159 private patient rooms, 16 ICU beds, 6 operating rooms, 2 catheterization laboratories, 1 biplane, outpatient cardiac services, cardiac rehabilitation, and non-invasive cardiac services.
Straub's Cath Lab is very state-of-the-art that was developed in concert with Dr. Moore, the specialist who came from the mainland, along with Dr. Sim, the local pediatric cardiologist.
Device technology and cath procedures advanced very significantly during the decade of the 90s, so we're able to now do a lot of things that were formerly done by surgery here in the Cath Lab.
Straub Heart Center was able to conduct minimally invasive procedures on this new system to treat a wide range of clinical problems, including coronary artery disease, a leading cause of heart disorders in the U.S. Treatments include ablation, angioplasty, directional coronary atherectomy, rotablator, drug-eluting stents, pacemaker implants, and implantable cardioverter defibrillators.
Catheterization is a simpler technology than surgery, so we're able to do 2, 3, 4, 5, sometimes patients a day. The way we're able to see the heart is through the X-ray and also through the injection of what we call contrast agent that looks like this black ink right inside the heart, and this silhouettes the inside of the heart chambers.
This fully digital system enables physicians to capture and view detailed images of a patient's cardiac vasculature, thereby facilitating faster and more accurate diagnosis and treatment of cardiac disease. Equally important, it exposes patients to less radiation during the actual procedures than any other system. Max Pfluger is one of those patients.
It was his yearly checkup with his pediatrician, and they heard us just checking his heart and heard a swishing sound.
And he was found to have a heart murmur, and an echocardiogram was done, which showed a moderately large atrial septal defect, which is a hole between the top 2 chambers of the heart.
We met with Dr. Sim the day after, and he told us about Dr. Moore and the procedure and showed us the device and answered our questions.
Thank you guys very much.
Thank
Our
you.
pleasure.
We were very comforted to see that he could be taken care of by the best physicians here in Hawaii. We didn't have to travel, we didn't have to interrupt our family and take time to go to the mainland and be in a foreign situation. We wanted it to be as easy as possible for Max.
The Straub Heart Center offers the full spectrum of diagnostics and interventional cardiology services, as well as cardiac surgery. From prevention to diagnosis and screenings, to treatment and a comfortable recovery. You can expect a level of expertise from our center and specialists that rival any major cardiology center in the country. For example, experts from Straub and Stanford together performed the first cryoablation technique in Hawaii.
We have Dr. Van Heer who comes and he does electrophysiology studies on the pediatric patients.
For the last 18 years or so, we've been using radiofrequency ablation as our primary mode of repairing or correcting heart rhythm problems.
Traditionally, we've used a heating source to do this, called radiofrequency catheter ablation.
The only drawback of it, really, is that is a little bit difficult to control, and if you're working very, very close to the heart's normal conduction system, the structure called the AV node, there is some risk with radiofrequency of causing heart block.
But in the last year or so, there's a new way to do it in which we freeze the tissue, and we call this cryoablation. George Van Heer has been coming down from the Stanford program and helping us with our youngsters, doing a great job, and he had mentioned it to us if we'd consider it.
The advantage of freezing is that it's much slower. The cooling of the tissue happens gradually rather than over the space of 30 or 45 seconds. Radiofrequency, the heating of the tissue occurs very rapidly over the space of only 1 or 2 seconds. And that's important because with cryoablation, as you cool, you can watch the effect of what you're doing.
If we see or notice damage to the good wires, we can turn it off and presto, we get restoration of normal function.
So basically, that allows us to work very close to the AV node without having any substantial risk of heart block. It's a particularly important technique in pediatrics. Most of the time when a child or a teenager has episodes of sudden racing heart rate, it'll turn out to be one of the several forms of SVT.
It just starts up sometimes, and when it does, I have to try and stop it.
It started when she was a baby, but of course we didn't know at the time what it was. But you know, when it happens, her heart rate can sometimes go up to about like 250 beats a minute.
Our target is just a little tiny strand of heart muscle that's creating this problem, something she's probably born with. We really feel very strongly in pediatrics that cryoablation is the way to go for any type of heart rhythm problem.
You know, since it was successful, I think that, you know, it's she won't have to worry about it anymore. If anything, she's upset about missing school for even one day.
I just like school. It's sad enough missing one day, and if I had to go to the mainland, I'd probably have to miss like maybe 2 or 3 days, and it's bad enough missing one day.
Straub's comprehensive team of experts work closely with the best in the country. This is why Straub is a leader in heart care for the state of Hawaii.
You know, it's a team effort in a sense that from start to finish, we have to communicate with each other on patient care, and we pride ourselves in being a very good heart unit.
I think that's the strongest point of the whole practice of medicine. It's all about the patients.
Thank you, Straub.
And that will unite us to, you know, do great things together.
Straub is an organization of people committed to providing integrated health and medical services which are comprehensive, caring, and continuously improving. When it really matters, people turn to Straub.